Hi, my name is Vincent. I'm a student nurse at Aspen University, and today's topic we will be discussing is the upper respiratory system. This is Adult Health 2. So, in this model, we will be discussing the upper respiratory system and describing the process of inhaling and exhaling. So, when you come to when you come to the process of inhaling, the diaphragm is going to be located under your lungs. It's going to contract, which is tightening, and move downward. This increases the space in your chest cavity, into which your lungs are able to expand, as you can see on the model here. Let's see, I'm sorry. Go down. Okay. So that's the process of the lungs right there. When it comes down like that, you can see it deflate and inflate. And so this is basically, as your lungs expand, air is going to enter your nose or mouth and is warmed and moistened. At the same time, carbon dioxide, which is a waste gas, moves from your blood to your lungs, and you breathe out, which is exhaling, which this leads us into the next process, is when you breathe out, your diaphragm relaxes and moves up into your chest cavity. As the space in your chest gets smaller, air-rich and carbon dioxide is forced out of your lungs in one pipe and then out of your nose or mouth. This is basically life-saving techniques that our body does automatically that we don't even realize. And as you can see in the description here in the bottle, I can push it up, and it pulls right back down. And that's kind of the process that we're looking for. So, and then in our next part, the question asks, why do some people have larger or smaller lung capacities than others? And that's pretty much based off of your age, your gender, let's see, basically the way your body is positioned. That also is an issue as well. Let's see, from birth to adolescence and plateaus at 25 years old is your lung capacity. Males tend to have a greater lung capacity than females, and that's just due to the stature of the person and their frame. Let's see, physical activity, chest wall deformation, and respiratory diseases such as asthma is also factors that will affect your lung capacity. There are 7 steps in the process that we deal with when you are exhaling, and that's what I explained earlier. The diaphragm moves down as it contracts, air rushes through the nose and mouth, passes through the throat and airs, and moves into the bronchi and the alveoli, and then expelled by the lungs. So then we have describe how asthma affects the lungs. And with asthma, it affects the lungs in the capacity of, due to the inside walls of the airways, they become inflamed and swollen, which causes the airway linings to secrete excess mucus, which it makes it difficult to breathe because your airways are narrowed, which is causing coughing and wheezing, and that's what you can sometimes hear in folks. When they have it, they're like, and you hear it right at that inspiration point. So with that, and that's usually an acute attack, so you want to have that treated. And some of the priorities that we would do in that medical process, we would want to manage the asthma by evaluating the respiratory status, monitoring the severity of the symptoms. We want to know what the O2 sat is by using a pulse ox, which can be, we want it, at least for me, I like it to be above 93%, because then I know that they're not using any accessory muscles, and they're getting their full expansion of their lungs. I will want to monitor their vital signs, and then I want to give them some medication. A lot of times you want to use corticosteroids because those alleviate the symptoms, and then we want to go ahead and do some anticholinergics, which reduces the vagal tone of the airway, which allows it to breathe, allows the person to breathe better because it relaxes that airway muscle, so they are not struggling. And then basically we're going to use anti-leucotines, which are bronchoconstrictors, which are going to dilate the vessels for more permeability of your oxygen cells to expand. And then we have most important thing I would want to teach my patient when it comes to asthma is follow your treatment plan. That's why it's there. That's why your doctors have prescribed it and took the time out to make it. And secondly, know what your triggers are, avoid them, especially your allergy and asthma medicine. Know when the onset's about to start so you can be proactive and take it quickly before it gets even worse for you. And then some of the community resources that are available would be the Asthma Community Network, which is national and federally funded, along with the American Lung Association and the Asthma and Allergy Foundation of America. And for locally in Arizona, we have the Arizona Asthma Coalition, the Arizona Department of Health Services, and the American Lung Association of Arizona, which are all nonprofit and can give you all the resources and tools to be successful in managing your asthma. But my name is Vincent, and I thank you for your time. You have a good night.